Since I retired in 2010, Susan in 2014, we have done at least 3 or so big trips, sometimes 4 a year. We love travel because we've read about these countries, we've seen documentaries, movies, etc., but to be there, to actually stare up at the Eiffel Tower, to be in a bull ring in Spain, to have fish and chips in one of the oldest inns in England. It was just a great experience. In 2014, I was diagnosed with large B-cell diffuse non-Hodgkin's lymphoma. The chemo I went through, the 6 months of chemo that year, took care of the mass. And all of a sudden, a couple years ago, I felt a lump on my back, and that was the start of my second chemo journey. Okay. Very good.
All right.
Went into remission for 2 years, but the blood tests and all that showed that it came back. And that's when Dr. Beer introduced us to the concept of CAR T.
CAR T, chimeric antigen receptor T cells, are the patient's T cells, we'll say genetically altered or engineered so that they express a receptor for a target on their cancer cells. We stimulate those cells using what we call growth factors so that we can get a large concentration of them.
4 weeks later, after they've proven that they accept this substance, they're reinserted into the body, and the white T cells fight the cancer cells. And he said it was either that or further chemo. And I'd already been through chemo twice. I said, let's try CAR T.
One of the unique things about CAR T is that outside of autologous stem cell transplant, after initial therapy, it's really their only legitimate chance at being cured, meaning having the cancer go away and never need treatment for it again. That's what makes it special to me, is the chance for cure.
I think it was easier than my original chemo, because that was a whole summer. That was 8 weeks of being really knocked down. Hair loss, no strength. CAR T was once and done, and after I recuperated, it's phenomenal. When I had the opportunity to get to CAR T here, I was really grateful. Lancaster feels like a small town, but we have a very good hospital system.
The first adult was treated at Penn Medicine with CAR T therapy, and the first child was treated at Penn Medicine with CAR T.
Knowing that they're on top of innovation is very comforting. That's why this area is one of the best places in the country to retire. Old folks need medical care, and what you get in this area is excellent. I can't say enough about the nurses and the doctors here at LGH. At the Cancer Center, we became friends through my treatments. When I go to see Dr. Beer, when he comes in, we shake hands and he says, "How are you doing?" I said, "Fine, fine." He said, "Where are you going next?" And then we kind of start the visit lightheartedly, tell him about our trips that are planned and where we've been in the last few months. And he just enjoys hearing about that.
Don is a jet setter. My hope for Don is that he's freed from cancer forever. And every time that he follows up and he's doing well, and I'm hearing about stories of travels, past and future, instead of hearing about symptoms from cancer, we're winning.
When you're diagnosed with cancer, it's not the end of life. It's the beginning of an adventure, a trial. It's tough. Yeah, it's tough. But when you consider the alternative, you don't want to give up. Cling to life. There's so much good about it. So just join the fight. I thank God for my health, for the time I have at this point, and I count every day as a gift.